time to talk about this very important issue, and we're so pleased to have in studio former LA Times reporter Irene Garcia, now with Judicial Watch, and via Skype, Dr. Sanjay Jain, board-certified physician, author of the book Optimal Living 360, Smart Decision Making for a Balanced Life. Thanks to you both for checking in here today on America's Forum. Irene, we followed the time-honored tradition of ladies first, and you're here in studio. What is the latest you've uncovered on these health issues and the illegals?
Well, that the government is playing down, drastically playing down the severity of the crisis. We obtained a letter that was given to us, to Judicial Watch firsthand, from Phil Gingrey, a congressman from Georgia, who's also a medical doctor, who has knowledge from his people on the ground that the illegal immigrants are bringing in diseases that have been thought to be eradicated or largely controlled in this country. For instance, tuberculosis. They're also bringing in swine flu, Ebola virus, and this presents a health care concern clearly, and they're also dispersing many of these illegal immigrant minors to other parts of the country, which the congressman points out in his letter to the head of the CDC.
So my old colleague, Dr. Phil Gingrey, as he's about to close out his term in Georgia, again opening up the notion of what's happening in terms of public health. And Dr. Jain, this is where you come in. TB, an illness that we thought of really as an anachronism here in the United States, pretty well controlled. But what are the possibilities here with these illegals bringing it back in? Is this easily spread among our populace?
Thank you for having me this morning. So first of all, TB is a bacteria, and it's spread through aerosols, most prominently through respiratory ways. So what happens is that when you're in an enclosed environment, especially with these immigrants who come in and they're kind of quarantined into a small confined area, this can rapidly spread. So in a hospital, when someone's actually admitted with TB, active TB, they actually are put into a separate isolation room. And so there's a certain way of aerating the room. They kind of call reverse aeration so that the respiratory aerosols from the TB doesn't spread out. But if you're bringing these immigrants into a closed environment, they don't have that facility that they have in a hospital where you have reverse aeration. So what happens is that you're increasing risk not only among maybe even one person having TB and spreading amongst the other immigrants, but then the healthcare work is getting exposed as well. So, there's a lot of conflicting information out there in terms of what is true, what's not true, and I really put a lot of stock into what the people on the ground see. And so that's the biggest issue, is how do we eradicate or actually screen for this, people crossing the borders? What's the best way to screen? Now, as most people who know with TB, they screen it with a PPD test. It's a very simple skin test where they actually take a little sample with a little small skin prick, and they check your skin within 48 to 72 hours. The problem with that is that you get to keep them, and the healthcare workers have to watch them over 48 to 72 hours and see whether there's a positive skin test. So they also have other types of testing done, but it is an issue.
Well, it is an issue, and you mentioned what's happening on the ground, and let's bring it back here to Irene Garcia in studio. On the ground, have you, in your role in Judicial Watch, you've been hearing from Border Patrol agents, but we've been hearing reports that in some areas, healthcare workers have actually been told, don't talk to anybody about this whatsoever. What have you found?
Absolutely, absolutely. The Border Patrol agents and supervisors that have contacted Judicial Watch have said the same thing. There's widespread censorship from the administration to try to muzzle those folks that want to get the truth out, and they're really limiting and even forcing journalists to sign waivers in agreement in advance of going to some of these shelters, that they will not film, that they will not talk to some of these unaccompanied alien children. So there's some very big control on the part of the government to keep this information from the public.
And Dr. Jain, as we hear about the control the government is trying to exert on members of the media and some members of Congress who have oversight on this, what about the situation for the contagion? Because you talked about what a hospital needs, but as we understand from so many of these detention centers, at least initially, there was just a piece of yellow, almost crime scene tape trying to separate those infected from other members of this illegal population. Is this a recipe for an outbreak?
Well, I don't want to be an alarmist, but there is obviously concern. The biggest problem is how are we managing the people who are actually positive for TB? And you're quarantining them in an area, but then how were they exposed before to the children? Now, I have young kids, and you put kids in a daycare, you get one or two kids that are sick, and they all get sick. So we're talking about young children here, and I'm not too sure what the age range is, but the bottom line is you're putting these people in a closed environment. You don't have them isolated. I'm not sure if they're putting masks on these children and what the actual ground treatment is. So to speculate right now for me to say what is actually going on the ground, I can't really say that right to this point. But I do say that in a very controlled hospital situation, one patient is isolated from all the other patients. So I'm not sure how they're isolating these cases on the borders.
Well, as Dr. Jain mentions, Irene, you have a situation where, in terms of healthcare protocols, isolation is called for. Obviously, that's not happening on our borders, at least not that we've heard. And then you've got the problem compounded by the government saying we're going to carefully control the information coming out. Now, Dr. Jain, as one of the uncertainties he was talking about, talked about these minors, these children, and again, we hear reporters, for example, I heard a White House reporter from one of the alphabet networks always refer to these as moms and kids, moms and kids. Again, give us the reality check on who makes up the population of illegals coming across our border.
Well, the reality is this, and this is something that I just wrote about for the Judicial Watch Corruption Chronicles yesterday. The MS-13, one of the deadliest gangs in this country, is actively recruiting at these shelters. And we got this straight from some very high-level people in the Department of Homeland Security, Border Patrol officials, and this is what they're doing. Then these new recruits are using the phones provided by the Red Cross, okay, get this, by the Red Cross at these shelters to then communicate and solidify their deal or their contract with these gangs. The 18th Street Gang, which is the largest gang in Los Angeles, and the Mava Salvatrucha, known as the MS-13, which is one of the deadliest gangs in this country. So gangs are actively recruiting. We have the health crisis. These aren't just moms and children and young kids, as Judicial Watch has reported in the past too. A lot of them are older kids, probably young adults that have ties to criminal enterprises. And this is the kind of thing we're not seeing in the mainstream media.
And of course, much has been made of the William Wilberforce law, saying that this was to allow kids from Central America to come in on a humanitarian basis. But there's nothing to say that people from Mexico can't say, oh yeah, I'm from one of those Central American countries. There's no proof that these are children coming in from Central America per se.
No, there's no proof. A lot of them have no identification. They have no documentation of where they're from, and they're coming in such large amounts. The Border Patrol is overwhelmed, and we're hearing this daily from our Border Patrol sources. They are overwhelmed.
Dr. Jain, you have taken great pains, and we appreciate it. You say, look, you don't want to be alarmist. And obviously, your realm is science, not so much public policy. But with the suppression of information, what does it sound like to you? Rather than sharing information with the public, especially in terms of public health, this failure to share information, is it putting us at risk in terms of public health?
Well, there's a lot of conspiracy theories out there, and obviously there could be a political angle to this. But the bottom line is the CDC and the state health department should really get involved, especially the states where the immigrants are really coming through, and really tackle this problem. And whether they're disseminating the information or not, they need to go in there and actually account for all the immigrants who are coming through or at the borders, and really do a fine tooth and comb. You know, doctors in other parts of the state, and we're talking about normal immigration, people who come in on a legal basis, they still have to go through medical examination. They still have to go through a lot of medical, there's a checklist of things that they have to go through to be cleared. So they have to go through a very similar process to evaluate these immigrants. You can't treat them differently than an immigrant who comes in through legal means. And so you have to go through a very strict process in terms of how you're going to evaluate these immigrants, go through your checklist. I mean, I don't know what the pathway they actually took to get to the borders, but I can imagine them going through a very tough terrain, picking up different type, not just TB.
So
but,
much to
tapeworms.
consider here, Doctor, and unfortunately our time is running short, but we do appreciate what it is you have to say to us, and we thank you for your time. Again, Dr. Sanjay Jain, the author of the book Optimal Living 360, Irene Garcia, formerly of the LA Times, now of Judicial Watch, we thank you for your time. Sounds like there's a new angle to cover. Are the state health boards getting in on this? We'll take a look at that, and we'll have more on America's Forum right after this time out.